Welcome to Stroke Forward. My name is Marcia Moran. For the next 40 minutes or so, we are going to talk about things that stroke survivors or any brain injury survivor deals with. If you look at me today, you probably don't see a person who had a stroke, but I feel it. My body functions differently. Do I think I will get back to 100%? Yes, because to think differently is to admit defeat. We will talk to all sorts of people who have been there, from survivors to caretakers to doctors, nurses, therapists, friends, and family who have seen us at our weakest. They have cheered us with their victories, no matter how large or how small. How did we get here? That's what this show is going to tell you. Abbe Simon, MA, CCC, SLP, has been a speech-language pathologist for 24 years. She has worked in a variety of settings, including acute and rehabilitation hospitals, assisted living facilities, skilled nursing facilities, aphasia centers, and outpatient clinics, while seeing clients privately. Throughout her career, she has remained passionate about working with adults with neurological language disorders resulting from stroke, traumatic brain injury, brain tumors, degenerative disease, and/or age-related memory decline. To broaden her ability to help clients find wellness, Abbe became a certified integrative health coach in 2021. This training allows her to offer care partners support in order to achieve individual goals that encompass health, wellness, and happiness without neglecting their loved one. Abbe specializes in evaluating and treating people who have aphasia. Her approach revolves around an individual's goals to create functional, engaging, relevant, and purposeful outcomes that go beyond a treatment room. She provides therapy driven by evidence-based practices while modifying programs to suit each individual client's needs. Abbe prides herself on the relationships she builds with clients and their communication partners. After years of serving people with aphasia, Abbe learned and witnessed the power of intense and consistent skilled therapy. Her work as a communication coach and group leader at renowned aphasia centers allowed her to see the benefit of immersing in productive language opportunities that last more than a typical 45-minute session. As an SLP, Abbe has seen firsthand how care partners' life changed when a loved one receives a sudden life-changing diagnosis. Because this new role often impacts health and wellness, Abbe has created programs that coach care partners along their unexpected journey. I am delighted to introduce Abbe Simon. We met at an event for stroke warriors in North Carolina and got talking about some really interesting ideas. So today we decided to chat a little bit about Aphasia Awareness Month. How are you, Abbe?
Thanks, Marcia. I am doing well. How are you on this humid, hot June day here in North Carolina?
Well, I don't know because I've been inside all day.
Oh, okay. I'm not sure if you have it a little cooler than we do, since I'm a little further south than you are.
Yeah. So you're a speech language pathologist and integrative health coach. Tell me about that part of your life.
I'd be happy to. So it sounds like a mouthful. I'm a speech language pathologist and an integrative health coach. And I'll focus on the first 25 years of my life first as a speech language pathologist, or speech therapist, as some people refer to themselves as, because it's that part of my career which has allowed me to come to where I am today. As a speech language pathologist, I have focused on helping adults who acquire communication disorders. And by acquire, I mean they're not born with a delay or an impairment, as some children are treated by speech therapists for. The people that I have worked with, while I have, of course, during the course of my career, worked with people of all ages, the expertise I am most passionate about is working with adults.
Okay.
And so adults can require some speech therapy to improve their communication for a variety of things. Would you like me to tell you about
Yep.
So some of those things, most commonly, one might think of a stroke, which is a dysfunction in the brain that happens from a blood clot or blood burst. People could have a brain injury from trauma. People might develop a neurological illness like Parkinson's disease or Lou Gehrig's disease or Huntington's disease, or other brain changes that affect the language part of their brain. And when the language part or center of your brain, which is typically on the left side, is impacted by one of these insults or changes, communication can take different forms. And by communication, I don't necessarily mean being a public speaker and just providing verbal output, but I mean communication in terms of comprehension, reading, writing, as well as speaking. So those are the 4 parts of communication that a speech therapist can address so that a person with a communication impairment, and today we're going to focus a lot on the 7-letter word called aphasia, because it is, as you said, June is dedicated globally to promoting aphasia awareness. So I hope today, based on our experiences, we'll get to dive a little bit more deeply into that. And then real quickly, when I began to find myself being called to help the multiple relationships that are affected by aphasia, meaning aphasia doesn't just happen to the person who has it. Someone might acquire aphasia from a stroke or other reason, but every relationship in that person's life is also impacted by aphasia. And as a speech therapist, my requirement is really to work with and train and educate the client that has aphasia, as well as to provide that skilled information to their care partners or their communication partners. So to take that a step further, I said, I'm going to go to school and become this integrative health coach, not so I could help people lose weight or balance their hormones per se, but so that I could have some formal training on how to coach the people I call care partners, who also need some support as they are minding and caring for a person with aphasia or other neurological illness. And that's a big part of what I love doing as well.
Wow.
Hope that was not too much information in one response.
So I find it interesting that you help the care partners, because I had a stroke 8 years ago, and I had 4 speech pathologists that helped me. But my husband had nobody. I think it would have been really interesting if he had someone to help him as well.
Yeah.
Okay.
No, I'm appreciative that you're telling me that.
Yeah.
I'm curious though, did he join you in any of your speech therapy sessions?
No.
By his choice or your choice, or?
We didn't even think about it. So.
All right, well, that's history now, but I would have changed that.
Right. So let's get into this as it relates to aphasia. So what is aphasia?
Okay, that's a good question too. Sometimes I like to tell people what aphasia is not, but let me do that first.
Okay.
Aphasia is not something that you catch from somebody else. Aphasia is not something that causes an individual to lose their memory or their intelligence or the information that has been stored in their brain prior to getting aphasia. Aphasia is not something that only affects a couple of thousand people in this country. And aphasia is not something that improves within a certain period of time. And aphasia is not something treated with medication or a pill.
So I need to understand this a little bit more. You said aphasia does not improve with a period of time?
So So maybe I'm using double negatives, and I could write something down if you want, but aphasia does not improve just within a small period of time.
Okay.
So who was I talking to this week that said, oh, I know. I was speaking to the wife of a man who just had a stroke, and she said, I know it's the first 6 months that are the most important for him to recover. And that's not true. Aphasia might improve within 6 months, but it might improve if we need at 6 years. I know that sounds like a big amount of time, but I have worked with clients who had their stroke 2 or 3 years prior, and they still improve. So that notion of you only have a short window to get better is not true.
Okay, so I have to speak up here. I had aphasia, and I had it for 3.5 years. And I found a therapy that made my aphasia go away in 16 sessions. So if there is anybody out there who is looking for a way around aphasia, you could contact me or you could contact Abby, because we know that it goes away.
And what you just said is really important. You didn't have those 16 sessions right away, did you?
No, I had to look for somebody to help me.
And it wasn't until 3 years after your stroke that you got that help, which is proof that aphasia can improve way beyond 6 months or a year. Okay. So here's what aphasia is. Aphasia is something that is acquired, or you get it, and you get it because something happens to your brain. You don't get it because you drink too much. You don't get it because you don't eat enough. Well, I guess we could say you don't get it because you don't eat enough vegetables. Okay. You may have a stroke because your diet isn't good, but that's another story.
Right.
You get aphasia when typically a stroke happens. Aphasia is a language disorder. It results from damage to the left, typically the left side of your brain, that's responsible for those 4 language or communication modalities I mentioned earlier. Aphasia is not the same for everybody. Aphasia affects more than 2.5 million people in America. So that's more.
So that's 2.5 million. That's quite a number of people.
Can I write that down, Marsha? Just for if there's anybody that's watching that has aphasia, I don't know about you, but a lot of the people I work with, they really benefit when not only do they hear information, but they see it, which often helps with quantities and numbers. So 2 million plus 2 million, at least 2 million people in the United States of America have aphasia, which is way more than people who have Parkinson's disease or muscular dystrophy, words that we may hear more often and know more about, which is why this month of June is devoted to promoting awareness about aphasia, because of how many people it does affect.
So I heard that it's only 8% of people in America actually have heard of the word aphasia.
Correct.
So how do we get around that? How do we, other than having this podcast, how do we help people understand aphasia and what it does to people?
Spread the word, talk about it, don't hide it, and ask questions. And as you know, and a lot of the listeners might know, in March, when we heard the famous Bruce Willis actor had retired because he has aphasia, the news was blowing up internationally even about what aphasia is. And unfortunately, there were some misconceived impressions and some actual misinformation in the news and in stories about it. So people like me and like you who feel passionate about advocating, need to really and truly talk about it as much as we can. And I always encourage people who know aphasia firsthand to do something, especially this month, and let someone they don't know what aphasia is. And that even if someone has a communication problem, it doesn't prevent them from being communicatively successful, right? So you are wonderfully able to speak everything that's in your mind, your opinions and your feelings, and ask questions. Someone with aphasia who may not have access to that verbal fluency can still communicate, but it's up to their communication partner and those around them to know how to speak in a way as an adult deserves to be spoken to allow them to get their points across, which does not happen overnight.
Okay, so tell me the ways that you see people could communicate.
Mm-hmm. Well, do you mind if I know we're supposed to have a conversation, you and I. Do you mind if you tell us, before your discovery of the help that got you through your aphasia, what did you do before that in order to let your husband know you wanted to go to Starbucks and have a large coffee? How did you do it?
Well, he just did it.
Oh, he did it for you?
Yeah. So it's interesting. So when I had aphasia, I had Broca's aphasia. So I had it just before my before the left ear, and Wernicke's is behind the ear. So I had aphasia. People could talk, and I understood everything they said, right? And I had what I wanted to say back to them in my brain, but I couldn't get it out.
Those words you said.
Yeah, Broca's.
Right. You had this one?
I had that one. Yeah. So I tried to figure out the words that I could say and tried to say those. And so I had two people in my head, right? And sometimes I could say them, sometimes I couldn't say them, sometimes I got a few words out. It was really, if I was tired, if I was frustrated, nothing came out. Mm-hmm. And so when I was first in the hospital, I think nothing much at all came out. I went to rehab, a little bit more came out, but I had to work on it. When I was at home and I had the home health care helping me out, she said that I had learned everything I needed to learn and I would be fine. It would just take me a little time. I will tell you that that was not true. So I could talk only at the conversational level. Anything deeper I couldn't get. And if I was tired or angry or upset, nothing came out. So when I had neurofeedback, the two sides of my brain came together and I had one thing to say and it all came out my mouth. Does that make sense?
Yeah. I like the way you described sort of the evolution and the transformation of your aphasia from when it first happened until now. So I think that is, I appreciate the way you were aware of those feelings and struggles to communicate then and how much easier it is for you now.
You know, I actually got upset and frustrated with everybody, including my husband. And so I just shut down. Mm-hmm. And that is the wrong thing to do. The right thing to do for me, and I think anybody else, would be to power through it. But I just shut down. And maybe everybody shuts down. I don't know.
Well, the word shut down is good. It is basically the way you're describing the withdrawal you had, or possible lack of motivation or belief that things could be brighter and better. And what I often marvel at, Marcia, is the clients that I see, whether they're individually or in a group setting, they are motivated, they are determined, they are getting out and trying to make a change for the better. But what we need to remember is that after a stroke, depression can be real. And like 30 to 40% of people who have strokes experience depression. And I say it is totally valid. A life-changing event that happens in a second it's impossible to not have a slew of emotions to deal with while accepting the inevitable changes that await you. So needing to shut down might be what's necessary for someone at that time. And if they're not ready, maybe you weren't, you had to process and deal at your own speed. And then hopefully when you have the right support and readiness, you can take on the next step and work on it.
Yep.
But
So it was almost
that part. Sorry. Just that piece of emotion, the emotional piece that you mentioned by saying shut down should never be ignored. And as a speech therapist or any speech therapist working with a client who has aphasia, we should address those feelings, because oftentimes if a person has difficulty expressing themselves, people may ignore asking them how they feel, or they may not know how to ask somebody and provide them with tools that gives them the opportunity to express those essential feelings and needs. So it might be tender and hard and emotional, but it's necessary.
Interesting. So I felt like a little piece of me went away every time I had aphasia. So I went out to a meeting every week, and we all stood up and had a minute to introduce ourselves. And sometimes I said nothing, sometimes I spoke. It was kind of hit or miss. But every time I had my aphasia come up, I felt like a little piece of me went away, and I was getting smaller and smaller and smaller as the time went on.
When you say those groups, were they stroke support groups or?
No, it was local business people. And I was determined I would get my speech back, and I thought that would be a good way to do it. Well, it didn't really work, but it got a little help, because there was somebody in that group that had laser therapy. And laser therapy, I didn't believe it, but it was one tool in my tool belt that helped me get a little bit better. So it was interesting.
It was meant, even though it took something away, it gave you a lot more too, that group. So when you went to that business group, what business were you part of or trying to pursue at that time?
So I didn't have a business. I went to the founder of the group and said, I just had a stroke and I want to be here. That's all. And he said, sure, that's fine. Just come every week.
Wow.
And they were so supportive of me.
I mean, that's a form of integration or engagement that allows people to do things that matter to them. And as a speech therapist, over the years, we have seen the field of aphasia rehabilitation morph from when I graduated grad school. I will admit, it was much more of a routine therapeutic drill and practice process. Say this, do this, write this, repeat this. But what we know, and we should have known all along, is what matters in the therapy room is what's relevant and personal to the client. And that we could say this, write this, repeat this, as long as the words matter to that person, that they will be used in that person's life, and that they could then expand into other important topics. So making therapy about life and how one participates in life is how people get better best and how people get better fastest.
Interesting. Okay.
Mhm.
So the relationship between me and my providers was key as a patient. It sounds like it's the same for you. So what do you think makes it key for both of you?
Mhm. I love that you use the word relationship with your providers, because when I started my private practice, I felt the need to provide a program or an option for people to do what I named relationship centered aphasia programming, meaning I wanted to offer an intensive therapy option. There are centers around the country that are intensive, comprehensive aphasia programs where people with aphasia, perhaps you looked into them, go and become, it's a residential program in many places where you receive hours of therapy a day for multiple weeks. And
Mhm.
here in North Carolina, we have wonderful resources for aphasia, but we didn't have an intensive aphasia option. So I created this relationship centered aphasia program that provides, like I said, 3 hours of therapy a day for a minimum of 2 weeks. And why did I do that? So that we can intensively hone in on all of the relationships in that person's life. Not only the relationship they have with me in the therapy room for 45 or 55 minutes, which is integral in being successful, but how can we use the time best and include all of the relationships, the providers the person has, the pharmacist, their barber, beautician, their children, their cousins, virtually, in person. We have relationships throughout our day,
Mhm.
unless you're really just living alone and have no one to talk to. But if you're in a skilled nursing facility, you have a relationship with the med tech, you have a relationship with the diet department, the kitchen staff. All of those relationships are impacted by aphasia and need the support at least 1 or 2 times so that communication could be successful, even if it's in an alternative fashion. So my relationship with my clients is something I'm most proud of, sometimes to a fault, because as empaths, we tend to give of ourselves so much. And I invest my heart and soul in making the lives of my clients as whole and best as it could be, which takes a lot. And I do it because I'm a caring person, not because I'm looking to become a millionaire, right? I do it because I care so much. So I value relationships so much as a patient myself who has providers, and as a provider to the people that I serve. I think if the relationship isn't right and doesn't feel natural and comfortable, the relationship should not necessarily continue, and that you should find someone that gives you the comfort and ability to be yourself and improve.
Yep. Makes perfect sense to
And
me.
and that being said, I'm sorry to interrupt, but when I work with people, unlike your experience that you described after your stroke, I find it very essential to include people in some of the therapy sessions, even if the person is simply just watching, so that they could watch what I am introducing to help the communication be more successful. Because what happens in a therapy room is such a small example of what needs to happen in real life. So if the communication partner or the care partner isn't watching, they're relying on maybe the client to tell them. Maybe I'll send them an email if I remember, asking them to carry over what we've learned or what they've learned. But observing and participating or getting their own training is really important.
Okay. That makes sense to me. So obviously everybody knows about language, but what about the inability to write or the inability to read all of a sudden?
Mm-hmm. So the inability, did you say write and read or just read?
Oh, I said both. I said both.
Okay. So language is not, like I said before, like not only spoken language, there's
Yep.
reading out loud. So if you were going to be giving a presentation, if you're a teacher, if you're a pastor, If you need to, I just had a client, it's a wonderful story about reading, a client who prior to his stroke lost his father and remembered eulogizing his father in a very emotional and lengthy way. And his mother recently passed away, and the client has severe aphasia and apraxia, which prevents him from speaking words in a connected, fluent way. Mm-hmm. And because he could read and because he could listen and understand, he could benefit from seeing, believe it or not, my mouth on his phone and maybe some words that was written elsewhere so that he could speak the words he wanted to say and use me as a guide. So that wasn't necessarily reading, but it was using his visual ability to recognize signals to allow him to communicate and speak. People that have reading trouble, in the medical term, it's called alexia. There's different types of reading impairments that result from aphasia, and they could be addressed in a therapeutic setting. And when you also address reading, you're looking at how well someone understands what they're reading silently. So perhaps when someone has a moderate aphasia and too much information is overwhelming and hard to digest, we need to make sure we simplify, not in a childlike way, but just reduce the amount of verbiage or sentence length so that the person with aphasia could still understand the main content and main points of what they're reading. And that is also revealed in a therapeutic environment when the therapist knows aphasia well enough to be able to tease out the strengths and weaknesses of a person's reading and writing ability. And when we talk about writing, sometimes after a stroke, if that's the reason for the aphasia, a person may experience one hand or arm being weak, typically the right, and most people are right-handed. So their dominant hand for writing is sometimes affected. So people have an option. They can retrain their left hand to compensate and learn to write. They can use speech to dictate, speech dictation, so it's called speech to text. There's different ways to compensate if writing is a challenge. And we would be, or I'd be remiss if I didn't mention the word neuroplasticity, which maybe we'll get to in a few minutes. But when I said that that left hand could take over and learn to write, and this is something all of us should do, and listeners, if you can, try to pick up a pen and write, even your name or your phone number. Yes, it's a challenge. Yes, you'll appreciate what somebody has to go through who is not able to use their dominant hand, but you'll be giving your brain really good stimulation and cognitive enhancement opportunities. Because when you use something that you're not used to using, or it's not easy, it's really good exercise for your brain and neural connection. And neuroplasticity allows the brain to do and learn new things, no matter how old you are.
Interesting. So I actually read very well after my stroke.
Out loud or in your head?
In my head. I closed the book and I couldn't remember anything I'd read. I'd open the book, reread it, I'd remember everything, close the book. I couldn't remember it anymore. It took me, I'm going to say a long time to remember what I'd read. And my therapist had me read Dr. Seuss, and I think I've got it here. Fox and Socks. And it took a long time for me to learn how to say everything in this book. But now I love the book because I felt the first time I read it out loud without flaw, I really had a breakthrough.
I'm going to challenge you for one moment.
Yep.
You said when you first had your stroke, you could read well. you opened the book and you knew what you read.
Yep.
Then you closed the book and you forgot it.
Yep.
But I challenged that it wasn't that you forgot what you read, it was that your Broca's aphasia, that non-fluent, effortful production of speech, made it difficult for you to say what you did remember. In other words, if you read it, Marcia, right, and you were reading about Sammy bought a lemon from the fruit stand, I don't know, and then you close the book and you're like, oh, I want to tell Abby what I just read. Did you forget what you read, or you just had a hard time spitting it back the way you wanted to say it?
I actually forgot it. So
really?
I decided to read a book by Daniel Goleman. So it's a neurology book, and I thought, I'll read it. It's no problem. Yeah, it was a problem. I think if I'd read something a little easier, I would have had less trouble. But, you know, I thought I would read at the same level that I read before, which
I mean,
obviously couldn't.
Well, one of the things about aphasia typically is that aphasia does not typically affect your memory. It could affect your comprehension. Yeah. So when you were reading something that was complex, it may have been just too technical or too long or too detailed. Yeah. And therefore recalling those details was difficult. But if you read something simple and like, I forgot what I read, and I said, well, did he buy a lemon from the fruit stand or a watermelon? I would think you'd be able to remember that it was the lemon. So again, those types of things come with practice and rehearsal and attention. Yeah. But it's amazing that you know what was challenging for you then and what is no longer a challenge. Yeah.
So I could probably read his book.
Now you can. And then you could tell me all about it, because
I could tell you all about
that
it.
Author is.
Yeah.
What did he? I don't even know who that. Should I know that author?
Dan Goleman? I don't know.
Oh, okay. What kind of books does he write?
He writes, well, I have one, Social Intelligence.
Oh.
Yeah.
Okay. So they're technically challenging, probably.
They're technically
I'll
challenging.
write it down.
And he also wrote Emotional Intelligence.
Oh.
So I'm looking at the books on my shelf here.
So he is well known. I should know who that is.
Yeah.
Thank you.
Yep.
I'm adding it to my list.
Okay. So when I see someone on the street, do they need any help from me if they have aphasia?
Do they need any help from you?
Yeah.
Not unless they ask for it.
Okay.
Or not unless you saw somebody ordering something or trying to say something to someone and you noticed a real breakdown. And perhaps because we are good-natured and inclined to help, you could say, excuse me, do you need some help? I noticed you were having some trouble saying what you're trying to say, which really means my way of nicely putting that a person with aphasia shouldn't be spoken for unless they are really struggling and needing and asking for help. Meaning, if you are talking to someone with aphasia and they're trying to answer, they may not be able to answer you at that moment. And they may look around to like someone to answer for them or put the words in their mouth. And if we do that, if I put the words in one of my clients' mouths for them, I'm not asking their brain to work as hard as it can. And a skilled therapist knows the type of support or assistance to provide a person as they're improving and moving along their aphasia journey. But if you see someone or know someone with aphasia, don't assume that they can't do something unless they really demonstrate that they can't or need some help. So they may not be able to do it the way they once did, or the way you think that they should be able to. They just need to do it in a different way. And it's always nice to ask first.
Yep. Okay. No, go ahead.
It makes me think of another way that shows up. Okay. I mentioned earlier that speech therapists work with a variety of adults who have trouble communicating. And part of my life, I worked with people who had Lou Gehrig's disease or ALS. And some of those people with a very severe form, they benefit from using AAC or augmentative communication, which people with aphasia can use as well. But I'm thinking of myself standing next to a man who is in a wheelchair, who had a speech generating device mounted onto his wheelchair that he controlled with his eyes. So this is an extreme situation where this individual didn't have access of his hands. He wasn't able to type or push a button. He accessed the keyboard of his device by moving his eyeballs.
Wow.
And when we were talking and he was typing his answer, I inappropriately, as he was typing, I interrupted as though I knew what word he was going to say next, which was wrong of me, because that was taking away the power of his ability to do it himself. Now, with him and ALS, which is fatiguing, we want to preserve energy. It's a whole nother topic. So I think I was trying to not make him work as hard, but again, that's not my decision to make. You don't want to answer a question for someone or finish their sentence for them unless they ask for assistance. Yep. So that plays a part in people with aphasia as well.
Yeah. So my husband sometimes had trouble remembering that he should wait for me. And he actually did okay most of the time. But I wonder if I'd been required to say things myself, if I would have recovered differently.
I wonder if he sat in on a couple of those speech therapy sessions, if he would have learned how he didn't need to.
Yeah.
And it would be really great, Marcia, to hear how he would tell the husband or wife or another family member of someone with aphasia, his lived and learned lessons and what worked and didn't and what he would suggest somebody else do. That would be a really interesting perspective.
Yeah. Yeah. So
maybe when he has free time.
Yeah, maybe. So you've talked about the integrative health coach and your work with care partners with people with neurological disease or illness. Do you find it's different for the different kind of diseases, or do you use the same process with everybody?
Great question. So the process that I like to refer to is a program that's called All About Balance. AAB, All About Balance.
Okay. And
making sure, and let me just define that the word care partner is the term I use instead of caregiver, because I feel very strongly that the person caring isn't only giving of themselves, but that it's a partnership. Because if the care person only gives and dotes and waits on and revolves around the person with the illness, they're not attending perhaps to their own needs and what part of the relationship needs to be given to them. And what I see is burnout, ignoring their own health and wellness needs, their self-care, and I don't mean going on a cruise or getting their nails done when I say self-care, because self-care means, believe it or not, spiritual, religious, hydration, academic, social life, physical needs, intimacy. These things make you well. It doesn't just mean that you're not eating a good balanced diet. So when I work with the care partner, A, I want to make sure that their communication health is good, but B and C, that they put themselves high on the priority list, just like they are worried or putting their loved one or other person on the list. Because oftentimes when the life changes for the person who had the stroke, the dementia diagnosis, what have you, the other people involved, their life changes suddenly also. And it's overwhelming to figure out, how much do I give? How much do I take from others? I can't tell anybody I need help. Or people show up with those cooked lasagnas like the week after the person comes home, and your freezer is full of food, so no one has to cook. But you know what? 2 months down the road, when the lasagnas stop coming, the person who's caring for and now making the lasagna himself or herself, they need to be coached and be sure that they pay attention to their own needs. And as a health coach, I'm not coaching people for months and months and years on end. I'm coaching them in a set number of sessions to say, this is where you are, this is where you want to be, because this is important, this is important, and I'm going to show you and guide you and listen to you so you get there without neglecting yourself or the person who needs your help. It's really, really important. And it sounds luxurious in a way. Oh, I'm going to get a coach to help me with my health and wellness. It's a necessity for people to not ignore their own needs.
Yep.
We do it. We do it as parents. We do it as professionals. And I think people are embarrassed to say they need help. But because I see in my office the reactions or frustrations and feelings of everybody involved, I felt the need to be able to help them more directly. So I went ahead and pursued that. Hope that makes sense.
That did make sense. Yeah.
Mm-hmm.
So we're coming to the close. I want to ask you, what is the one thing that you think the survivor needs to know and the care partner needs to know or do?
About aphasia or?
Yeah.
Okay. Yeah, this is all about aphasia, really. I know I threw in some other, comments about other communication or neurological disorders, but we're focusing on this 7-letter word. And I think the survivor of a stroke or other brain injury needs to know this. Aphasia continues to improve throughout time that you invest in working on it, committing to the recovery, and engaging with others in conversation and purposeful talking opportunities. Surviving a stroke or surviving some other brain trauma is in and of itself successful. And now one has to learn to live successfully with the aphasia. And it's very possible. And perhaps there's other concomitant factors where physical movement, walking, driving, swimming is a challenge or not accessible. But the inner you, your ability to be with others and share the information that you hold, should never be minimized or taken from you. So you have to fight, you have to give, you have to be present and do more than you think you can. When something feels easy and routine, you got to change it and make it harder. Because when something is harder, it's making a change in your brain and you'll make more gains and improvement that way. And for the care partner, I think the biggest lesson I would say, or the biggest takeaway I'd want them to know is, find a balance between partnering with the person that needs your help and being sure to meet your own needs, whether that is achieved by yourself or seeking resources outside. That may be an investment, but an investment in your health will make you and your loved one live longer and better. That was a good little spiel I just said. I should have, oh, you are recording this. I should have written that down because I feel really strongly about that. that it's a partnership, and the person with aphasia needs to know that it's not all about them. I know that sounds harsh.
No, it doesn't, because it affects everyone. And it needs to be on a journey together.
Exactly.
Yeah. Okay. So where can people get a hold of you?
They could get a hold of me by checking out my, God, now I sound so professional. They could check out my website. So my company or my practice is called iCommunicare, which I founded over 25 years ago when I married the word communication with care, because I help people communicate in a caring fashion, not realizing that in the last 2 or 3 years, I would become, or I continue helping people with communication, but that I'd also be helping the care partner. So iCommunicare NC, that's iCommunicare NC for NorthCarolina.com is my website, and I on Instagram and LinkedIn. Instagram is iCommunicare, and LinkedIn is my name, Abbe Simon. And on my website, you'll find out how to join my mailing list. I send out really great, juicy resources and information. And if you want to contact me, feel free. But what's really important is that you and I hope today, Marcia, let at least a handful of people know more about aphasia, and that they will tell one person every day for the next few weeks of June what aphasia is, so more people know it and know what it's not.
Hear, hear.
And know that it can improve like it has with you.
Yeah. Thank you. So thank you for joining me during Aphasia Awareness Month. It has been such a pleasure to speak with you today, Abbe, and I wish you the best.
Me too. Same. I hope we stay connected in other ways.
We will.
Join me next time when Jim Patterson tells us how the game of golf really made a difference in his recovery.